In the last 24 hours, we have tested a total of 308 samples.
And out of this number, 1,073 have been discharged.
We have suspended all flights effective midnight 25th March 2020. This now brings the total number of those who have tested positive for the disease in the country to 184. A lot of people did not actually believe it, but the figures that we have continued to show have clearly established that coronavirus is here with us in Kenya. Kenyans must treat this matter with the seriousness it deserves. All the 156 samples have tested negative. As a government, we are continuously improving our level of response. Why create a problem for the police, as in they have to arrest you, they don't have to arrest you? It is compulsory self-quarantine, so to speak. That some have decided to make fun and brand our effort as a PR exercise. So in this regard, you are your brother's keeper.
Many soldiers have seen firsthand the horrors of war. And terrifying though it often was, they knew who they were fighting and could recognize their enemy. The international community, Kenya included, is fighting an invisible enemy. The government estimates the country will record 10,000 cases by the end of this month, April, with frighteningly climbing curve of the coronavirus cases in the country. Kenya, already below the global standard of nurses workforce by 72,000, is struggling to contain the speeding virus. The Kenya National Union of Nurses is crying foul over underprotection, overworking and exposure to the infection. The Secretary General Seth Panyako has advised nurses to run away if no safe environment is provided by the employer. But how will the government prevent the frontline soldiers, who are the health workers, from becoming patients? This is NewsCompass. The hashtag on Twitter, NewsCompass. Later, we'll sample some of your feedback. I'm joined in the next 40 minutes or so by the CEC Health, Nairobi County, Hitan Majevdia. Appreciated your presence here on the broadcast, and thank you for keeping us company and, of course, showing up for the program. First thing is, starting from the county front, Bwana Waziri, at the county level, is that the City Hall has slashed some budget, 1.2 billion in the fight against the pandemic in the country. Do you think, in your view, from where you sit, your docket, of course, that is the perspective, that it's enough and a drastic one perhaps to contain the virus at the Kenyan epicenter, the Wuhan of Kenya, which is Nairobi County?
Thank you. First of all, we have not slashed the budget. We have increased the budget. It was not 1.2B, it was less. And it has been transferred to Nairobi Metropolitan Services. In health, no money is enough. Money is never enough. 1.2 is a drop in the ocean. But we are supplemented by the parent Ministry of Health.
Okay.
So we are working together, and I think we should have more funding from them.
Okay.
Yeah.
In regard to the response so far, in terms of the national government's efforts in coming up with mitigative measures to contain the virus or keep the virus at bay due to the speeding rate of the coronavirus in the country, do you think it's enough, and is your relationship worthwhile? Is it embryonic? And because there seems to be some form of division and standoff between the county administrations and the national government?
That division might be at another level, but on the ground we are working very closely. If you see, when our teams move, we move together. In terms of work, we are working together very, very closely, and we are synergistic. We have to work together. Yeah.
And do you think that the hospitals in Nairobi County, for instance, say those that come under the administration or the authority of the county administrations, are well equipped in terms of the drugs, essential drugs for that matter? And talking about issues that regard, of course, deficiency in equipment, are they equipped? And can the infrastructure support the cases that we have so far in the country, in Nairobi to be specific?
I think this question is self-answered. You have seen developed nations, America, UK, Italy, they were not prepared for this. This thing is a surprise to the whole world. So nobody is prepared. Not only Kenya, no country was prepared for this.
But we are continuing to witness cases where there seem to be a concern raised by the Council of Governors. Of course, Nairobi, notwithstanding special status it had acquired under the metropolitan stature, of course, following the handing over of some constitutional functions by the Sonko-led administration, that the chairperson of the Council of Governors said that the national government has no mandate, has no constitutional responsibility to recruit 5,500 planned workers, health workers for that matter, in helping the government to step up measures against the pandemic. I mean, doesn't that affect the smooth relations that we need to be fighting with the pandemic?
I think that is a political question. I'm not a politician, so I don't want to dive into that. But we do need health personnel. We are short of staff. And this is something known. For the last 10 years, we don't have enough personnel in the county government, especially in the health sector, because a lot of our staff have aged. They've gone, I mean, some have retired, some are old, and then we have also expanded. Nairobi has expanded, the population has gone up, so we need personnel. So we are short-staffed.
Okay, in that regard, even as you acknowledge the, of course, sort of understaffing in terms of the health workforce in the county, then you still cannot run away from the political aspect, because a policy decision at the end will be a political decision, of course, in terms of what affects the common monarchy. And here we are talking about Nairobi County, which is the epicenter, in this particular case, the umbilical cord of the country. Even as you regard that, do you still think the government, national government, is right in going forward with the recruitment of these 5,500 workers?
In terms of work, yes, we need them. But in terms of political, I don't want to comment. We need those 5,000 workers. In fact, we need more. So in that aspect, I would say, yes, we need them. But I think there'll be a solution. You know, we are still brother and father of two brothers, you know. It's in the same house. We will come to a solution. I'm very optimistic that a solution will be found.
Okay. What is the priority point here in regard to some of the, of course, issues that are on the policy table for you at the county level, and of course the other members of the county administration, in making sure that the confirmed cases in Nairobi do not spread beyond the border? So far we have cases in Mandera and in other counties, Kisii and Mombasa counties, that Nairobi County does not become the stemming point of the country becoming totally infected with the virus. And are the measures you are thinking about, or so far adopted in terms of your policies, enough to contain the virus getting out of the boundary of Nairobi County?
Yes, the measures are very, very strong and foolproof, but the problem is the human being, you know, the people. The people don't obey. If you see, even when I was waiting, people are just walking on the streets. They're not observing social distancing. They're not washing their hands, you know. That is the problem. Very nice policies have been made by the national government. We saw just now the CS talking. If those things are adopted by all and sundry, if me and you and everybody else adopts, I think this virus can be contained. But the problem is not the government. The problem is the population. And it is even worse outside Nairobi.
Okay.
Because, you know, we are social people. Kenyans are social people. We meet and greet and we hug and we touch, and, you know, I mean, so that is a big problem. You know, that education is important for such people, so that they know this virus, how dangerous it is. And they will only come to know when one of their own dies or is infected. So you see, we are lucky, we don't have so much. I mean, even 180 is a lot, but it's not as high as other countries. But Kenyans only learn when they get one of their own. You know, then you start hearing that family now talking, and they become our ambassadors. That be careful, they do this. You know, I mean, so it is us who have to take this war head on.
Partly, of course, the public responsibility is what you're talking about. Given that, and you have mentioned the fact that, of course, it's acknowledged and appreciated that there is a concern with the conduct of the Kenyan people, and that has been the same aspect in Italy, where when only 5 cases were confirmed, the Italian government and members of the ruling party said, you know what, Italians, go about drinking your aperitivo, which is the Italian word for a beverage which is alcoholic, and certainly hugging in public, and then thereabout the cases went out of control and exponentially grew. But even as you mentioned that, the national government is still what featured in your statement equally. Isn't it also responsible? And I'm sure you're not trying to absolve the national government in also taking the responsibility partly because of allowing the touching down of a Chinese plane carrying 239 passengers when of course, there was that fear across the world and we had no cases in the country. It ought to have been responsible, isn't it, to manage the control of what gets into the country?
Yeah, but you see, international travel is not a county government function, so it is a security function.
But you mentioned the national government, which of
Yes,
course has authority
yes,
over national security
yes.
and infrastructure, and defense and foreign affairs. My point was that even as you seek, you can't of course work alone as a county. You're not the standalone figure. In this particular case, we are all fighting. We want an outcome that will serve not only the Kenyan people, but equally will be of help in terms of our standards at the international arena. But given that the national government is equally responsible, isn't it, for allowing the touching down of that Chinese plane?
Well, I
just
don't,
want your judgment.
Yes, no, I would not like to comment. Those are not beyond my functions. You know, I'm not involved in the aero industry, or I'm not involved in the security. I'm only involved in my health sector in the county. So that is beyond my scope. It will be unfair for me to comment on that.
Okay, no problem. Of course, you reserve that. We live in a secular society. I respect your opinion on that. But given that talk of course, again, the response so far by the county administration that is in Nairobi County in regard to the nurses now, the welfare of the health workers generally. We have seen, for instance, in Italy, 18 doctors have died because of the coronavirus pandemic. And in Spain, 3,900 health workers were infected. And they are at the front line. They are decrying the lack of equipment. And of course, it equally is in Nairobi County. Some of these decries are springing out from. What's your response to the healthcare workers in terms of their welfare?
You know, when there is a war, in any war, there are heroes and heroines. In this war, the heroes and heroines are the healthcare workers. The doctors, the nurses, the pharmacists, the lab technicians, the community health workers. You know, they're in the front line. They're the ones who take the bullet first. Us, we are policymakers, we are sitting on a desk. They're the ones who actually come and treat a patient. They don't know whether he's positive or negative until he's tested, but he's already examined. Yes, we have a shortage of PPEs, but the national government has placed a very handsome order. They've started coming. We received some. We also received hand sanitizers from the national government. So things have started flowing in. You know, this thing was not expected. So even the national government, I can't blame them. But whatever we have seen, I think is appreciated, what they've done. You know, most of these things were imported. Now people have started locally manufacturing, which is also very good because it's going to create jobs even in future after this pandemic. So it has created innovations locally, and local talent has been seen. So I think we can't blame national government at the moment because they've done their best. They've done their best, and a lot of things have started flowing into all the counties, not only Nairobi, because we all talk, all of us talk to each other.
Okay. Mentioning all of the counties, here, of course, what comes to picture or to the fray is the 47 county administrations across the country. And there appears to be some form of standoff, and I mean, the sort of the thin and the fragile line in terms of who does what and in the pandemic. But are you not concerned, and I just want to seek your judgment again, that the collective lack of endeavor because of some county governments on what they have expressed is likely going to cost us in fighting the pandemic?
You see, all counties have different kind of challenges. Some have a problem of distance. For example, 2 days ago, Turkana was complaining that for them to bring a sample all the way to Nairobi for testing, by that time maybe the patient is dead, you know, because of the distance. There's no public transport now. So where do they do the testing? Us here in Nairobi, our challenges are different. Somebody in Wajir or Mombasa has a different challenge, right? So government, you know, all these 47 counties are children of one government. So they treat everybody equally, so they're trying their best. Like now, for Turkana, they've solved the problem. They're starting tests in Eldoret, which is some hours.
Which is closer in terms of
closer,
proximity.
yeah. So Eldoret will start for that area. Mombasa has started. Nairobi now we have 3 centers. So they've done. Let me tell you, they are overworking. You'll see they're giving statements on Saturdays, Sundays, public holidays. So they are doing their best. Even us, we work, county staff, we work 24/7. We have a rapid response team. We have a special committee for coronavirus emergency response committee, where most of the CCs are members, the governor, the regional commissioner. It's a whole team, And whenever we get anything, whether it's Saturday, Sunday, or weekday at night, we respond.
Okay, even as you mentioned that, and of course, it's the time of need, and we need to respond effectively. Our response needs to be on time, timely, and to address this pandemic. But let me just quote what the Kenya National Union of Nurses Secretary General Seth Panyako did say. I quote, "Where there is absolutely nothing to use to protect yourself," of course he was responding to health workers across the country, he said, "Our advice has been run away. It is the responsibility of the employer, in this case the county government and the national government, to ensure a safe working environment." In your view, is it a case of concern for his union or an irresponsible statement in the midst of a calamity?
It is a very, very right statement in his own way, because, you know, when you're having a corona patient, you're actually playing with fire. So yes, he's also right that there must be it's called the PPEs, the protective gears. But look at it this way. You are a doctor sitting in the hospital and you get a patient. Will you run away? They won't. Even if they are told by the leaders, they will not. A doctor has that conscience. He cannot just abandon his patients. He can't. They have that conscience when they're trained.
The concern is that, even as you mentioned that, and at the county front, is there a form of psychosocial support policy that you're working on to help them, of course, navigate the life waters in the aftermath when the dust settles and we shake off the pandemic in the country?
Yes, we have. That's what I said. We have this team, and we are already looking at things. We are looking at things not today, another 3 months. So next week will be another 3 months. So the other week, we are planning ahead of what's going to happen. And when the Secretary General is telling them that they should run away, they will not get that opportunity to run away. All this equipment and PPEs, the protective gears, are all coming. Some have already arrived, and I was told today they are offloading.
Okay.
So they are going to get them. This will be history. By maybe by the time we come back from Easter, I think most of the distribution will be done, because they'll also work. KEMS also works Easter. This is an emergency. We'll have to work. Yeah.
Okay, and also taking a look at the aspect of here, the public responsibility that at some point you mentioned the opening statement here on the broadcast about, of course, the 6-year-old child who died at the Kenyatta National Hospital, and the parents never informed the health workers who came into contact with him, because they have to attend to any patient who is admitted at the hospital. I mean, what is the public responsibility here in terms of being open, in terms of being transparent in regard to the status of the people they are admitting or supporting at the hospitals, so that the personnel, the health workers personnel, can equally come up with protective measures to protect themselves in terms of openly facing people who they do not suspect of being positive or negative?
You see, this virus is a very intelligent virus. Maybe even the parents didn't know. I don't know. I'm just assuming. The parents might not have known that the child is having corona. They just took the child innocently to hospital, and they must have realized there that this child was also positive. I'm assuming that is what happened, because you can't know. Even the people walking on the street, somebody might have it. You don't know. The new cases which we found this week and last week, these were people who traveled, who were in quarantine, and they were normal people. They were just in the hotel quarantined, and they were tested, because we test before they are released, and they tested positive, so they were taken to Mbagathi.
Okay,
yeah.
Well noted point. We'll come back after the break here to discuss the aspect of health being a devolved function and why there seems to be a concern by equally the Kenya Medical Practitioners and Dentist Union, who equally have voiced concerns in regard to what needs to be done, and have a quotation from the Journal of American Medical Association in regard to, of course, the depression and the anxiety that health workers do go through, and whether the sort of the disjointed effort between the counties and the national government can jeopardize, and what lessons we can learn after in establishing, rebooting our healthcare systems in the country and lessening dependency on foreign medical trips outside the country. The hashtag on Twitter, NewsCompass. After coming back, I'll sample some of your feedback, and we'll continue with the discussion as we finish up on the last segment of the broadcast. Stay tuned. Welcome back. You're watching the broadcast. We are into the second segment, the final one here on the program, as we continue to discuss the so far put in place measures by the government in regard to the coronavirus pandemic, whether that is enough, whether that response is enough, and the disjointed effort at the county and at the national front, and whether that can jeopardize our healthcare system in the country, even as the government responds to the coronavirus pandemic. Mama Mboga says on Twitter that there's need for having a healthcare system where all Kenyans can access. And of course, this can be done by visionary leadership in the country. We Kenyans need to vote for the right leadership when it comes to the right time. And she places in bracket 2022. We'll sample some of the other feedback later here on the broadcast. Before I get to the county news, Bwana Waziri, Hitan Majevdia, talk to me about the so far achieved outcome by the county administration of Nairobi County. And the reason as to why this is a very direct question is because the county is the epicenter. You are attracting the attention of Kenyans. And what you do here will matter a lot because it will either allow the virus to spread outside the county or ensure that it's contained within the county. So what is the outcome you have achieved so far since the outbreak was first confirmed in the capital city, Nairobi?
Okay, you see, the biggest achievement which the county has got is the education and sensitization. We have gone to the grassroots to educate people. If you pick up anybody, even an uneducated person from the slum, they know corona and they know how to avoid it. But the problem is they don't practice. They know. If you ask somebody, you pick somebody, even from the slum, who is not going to school, you talk to him or her about corona, they'll say they know corona. How does it transmit? Or if you don't wash your hands, if you are close to people, they know, but they don't practice. Now that is our biggest problem, as I told you in the beginning. But that is a big achievement. Everybody now knows.
Okay.
The other thing we have done is disinfection and fumigation. I think you've been seeing, even as we are talking now.
Of course, I witnessed that in my constituency.
Even now, as we are talking, Kibera is being fumigated. We are fumigating at night when people are asleep. And what we are using for fumigation is not hazardous to human health. So we prefer to do it at night when everybody is in the houses. So Nairobi, it's going to be fully fumigated, all the areas. We are doing mostly, we prefer to go to the poor people, highly populated poor people. We start there because those are the people where you see the contamination is higher, not in Muthaiga or Levington or Kileleshwa.
Okay.
So we are doing it in the slum areas mostly at night. So that is one big achievement. Markets, also all the markets, all the markets owned by the county have been fumigated already. They are done. Then public transport. You have seen, I don't know if you've been seeing, but all the buses or matatus now have a sanitizer or hand washing facility. We only have one problem. They tell us that they are not loading 2 people on one seat, but that is still happening. So that is another challenge we are facing with matatus. So the police is involved now. They know what to do. So that is the problem. Today morning also I was in Kamukunji. I met about 20 SACCOs of matatus with Safaricom also came on board. So we educated all the drivers, the makangas. Then we moved inside the buses and the matatus. We educated the passengers that don't allow a passenger to sit next to you.
Okay.
If you see that, report to us. The other achievement we have made, we have put a lot of hand washing stations in CBD and even in the slums. We have our teams going. We have placed hand washing stations. We have our people with sanitizers. That is one of the other achievements. The other one is we have reinforced government policies.
Okay.
So when you see Mutai Kagwe saying that do ABCD, we are the ones who go on the ground now to make sure what he has directed is actually achieved on the ground.
Okay.
So our team is doing what we do on the ground.
Okay.
Lastly, the last achievement. 2 weeks ago, I gave an exemption, or I waived all the mortuary fees for the Nairobi County.
The health docket county.
Health docket, yes. We waived all the mortuary. You see, some people are saying, are you expecting people to die and fill the mortuaries again? No, that was not the reason. Why did we clear the mortuary? You know, when somebody dies, there is a harambe. What is harambe? People gather. Together. Yeah. So we wanted to avoid that. So we decongested the mortuaries. We call them come. No payment, go and bury your loved ones. Right? So
All right.
these are some of the achievements.
Well noted point.
Yeah.
And of course, we appreciate, and that is purposely the responsibility that was bestowed upon you by the people of Nairobi County. But equally, I just want to seek your sentiment here in regard to this point, because entirely in Kenya, there are only 518 ICU beds against a population of 47 million. Of that, 87% are currently occupied. Doesn't that worry you as a key stakeholder?
It is scaring, not worrying, it's scaring. If this thing escalates, only God can help us. That is why we are telling people, let's not go there. Don't even think of that. We are in Africa, we are not in Europe. Even Europe could not handle it. What's going to happen to us? So the only solution we have is for us to control it. We are all the soldiers. Every Kenyan is a soldier. We have to fight it and make sure we don't reach there.
Okay, now, in regards to, of course, the other element of this time, of course, being the right time for the enmeshing of efforts from the national government and the counties, Nairobi included, there are concerns that some counties are becoming the hotbed of the coronavirus pandemic, Nairobi included. Therefore, movement is restricted. In that regard, how do you safeguard liberty, Kenya being a constitutional state in this regard, that this is for the best of you, and convince them that this is not again a violation of your constitutional rights?
You know, when it's a pandemic, we are lucky. The president did not declare an emergency. We are very lucky. The day the president of Kenya declares an emergency, it will be worse than what we are seeing now. I mean, we are just lucky the president didn't do it. In fact, we expected a total lockdown. He's so liberal, he has allowed us to go to work, go and buy our food. He's done a 7 to 5 a.m. curfew. So we should appreciate that. But if things go bad, there'll be a lockdown like other countries, like what is happening now in the UK and India. 1.3 billion people are in homes now in India. 1.3 billion. All right? We are only 46 million.
That's a quarter of humanity?
Yes, yes. So you imagine, we are so liberal now. So it is us, not the government. It is us Kenyans. We should be in the front line to fight this pandemic. Everything is not done by the government.
All right, it's the people who will, of course, and that has been the clarion call of the Minister Mutahi Kagwe. But equally, noting this point, this is the county that generates a lion's share of the country's GDP growth. And there is a gloomy economic prospect because of the coronavirus pandemic. How do you reach out to your disenfranchised, economical, I'm talking about, residents of Nairobi County in regard to food distribution and ensuring that the supply chain is not affected, even, say, if it comes to a total lockdown of the country?
Even if there is a total lockdown, the essential services will be working. Pharmaceutical, food, power and lighting, media. There is a list, if you saw, which was gazetted.
But there are some who can't afford food a day. So how do you reach out to them?
So now,
who are the majority?
Right. We know that there is poverty, and in Nairobi, majority of the people are poor. And if you go to the estates, to the slums, you will see what poverty is. It is understood. But you have seen a lot of associations, faith-based organizations, even some government agencies, they've started food distribution. I am sure, this country is loved by God. We have gone through hell in the last 20 years. Let's not go back to history. We have seen very rough times, and we have come out of it victorious. One good thing about Kenyans, when we have a common enemy, we unite. We unite. I give you an example of when we were attacked by the terrorists. Nobody saw this guy is from this tribe or that tribe. We were all one.
Okay.
This thing has also united us. Do you see anybody now politicking and talking anything?
Of course, certainly everybody there is a halt to all political processes.
Everything. Everybody is now fighting corona. No politician is talking anything. It's only corona. So we are all united. But you see, we have to unite from the top to bottom. So at the top, we don't have a lot of problem. People are obeying. We have a problem in the lower, the poor people, but also we can't blame them. They're living in small houses, 5 people in a small room, 8 people in a very small room.
Okay.
But you see, we have to educate them that, look, this is what is going to bring us problems.
All right, and when these restrictions will end, of course, normalcy resumes and we shake off the dust and we roll up our sleeves. What are the lessons then we can archive in terms of our healthcare systems and perhaps for Kenyans to access affordable and a flattened curve of healthcare which is affordable to them and accessible with no restrictions or that does not regard status? Because at the moment, if you're infected, whether you are at the top of the hierarchy or the bottom, you cannot fly out of the country for proper medication.
Yes, you know, every problem also you learn. This pandemic has taught us Kenyans, everybody, that we must strengthen our healthcare systems in this country. We should not rely on traveling outside for anything. You know, our hospitals, our health centers, our clinics, our industry, health industry must be supported by the government, and I think this is what's going to happen. This has opened the eyes also of people who didn't appreciate of what we were supposed to do in the health sector. So now they've seen that, oh my God, this is where we are. So I think this thing has taught people who make decisions will make good decisions now because of what has happened.
Okay, even in regard to that, as you envision that, in regard to those who make the decision, that decision needs to be good. Then how do we make that decision perhaps sort of like in appreciation of the German model of the healthcare system, where unlike other European countries like Italy, Spain, the UK, and France have not been affected, was not affected severely, or the severity is low. Do we need to embolden our healthcare system from the bottom up, from primary to secondary, and is that achievable post-COVID-19? Do you think there is the goodwill?
I think there is a very good goodwill, and I think we saw it. There was one of the big four agendas. One was health.
Universal healthcare coverage.
Universal healthcare. It had already started, and we got this corona. So it had already started, and it was going very nicely. And all of a sudden, we were distorted by this. But I think this thing is going to now give us bigger budgets. You know, the biggest problem we had was budgets. There was no money. You know, the other priorities. Now this thing is going to open the eyes of decision makers, myself included. Also, I make some of the decisions. So everybody else, jointly, we will say, now, this is what we saw. Suppose there is something like this again for our children or our grandchildren. What will they do? So can we make for them now if there is something like this in future?
And even as you mentioned that, going forward then, the envisioning point is perhaps even as a policymaker, there is that link that at an individual level or the country largely has to the international community. In your view then, because of the ravage it has caused economically, socially and politically, do you think the coronavirus will hold back the realization of the SDG goals that were set by the government for realization, which is equally a UN aspect in terms of countries that are on the development radar?
We must all agree it has slowed down everybody, not only Kenya. It's across the board, whether it's America, it's Kenya or China, everybody. This thing has hit us so hard, economically and socially. It has hit us below the belt. So yes, but you know, Kenya has very good partners. Our development partners are very liberal, very understanding, including China, where it all started. So I think some positive decisions will be made also by those partners to get us out of this situation.
Mess and situation.
Why should we call it a mess? It is a situation.
Okay.
Yeah.
And in your view, with no prospect of a vaccine and what appears to be more or less the remaking of a world order between Beijing on one hand, you have Moscow, the Kremlin on one hand of Putin and Donald Trump, do you see the superiority race for the global superpower is likely to affect the global health organization like the WHO in coming up with good policies for countries across the globe? And is that rivalry perhaps what is fueling the crisis at the moment?
You know, every industry or anything has rivalry. Even two of our children will compete to get attention of the parents. You know, so competition is healthy. If a competition is healthy, let them compete. It's going to benefit us. It is going to benefit Kenyans.
Okay.
Yeah.
How about challenging the scientists in the country, because you have hosted equally virologists and people who lead departments at the University of Nairobi here in the country and other high learning institutions who are very eloquent, of course, high standard, level-headed professors, doctors. Do you think that we can on ourselves perhaps develop the muscle to withstand and be part of the global community in coming up with a vaccine?
Now, you see, this is what I just said, that the government did not encourage research. With this now, when researchers, we have very good brains here in Kenya. If you see, even people working at Cambridge, but they're working under other partners from outside the country, but they're our people. They are good brains, but they don't have the resources, they don't have the infrastructure. Now with this pandemic, that can also be another opportunity for the government to say, okay, we'll also fund this research. And already we saw somebody is trying to do something in Naivasha, a research center. Yeah, so it has brought opportunities also for research. And the government will now look at researchers positively.
Okay,
yeah.
And perhaps give them the adequate attention needed in the country.
Not as only academicians, you know, now.
And equally as the citizens they rule over.
Yes.
Asante sana, Waziri. In Nairobi County Health CEC.
I have one more point,
if
you'll allow me.
Yes, go ahead, please.
You know, with all these problems, you know, county and even the national government, you know, we want to appeal to people, organizations. The people the poor people in Nairobi don't have food. So please come up, corporates, religious organizations, NGOs, come and help us. We will facilitate for you to go wherever you please. The most important we need now is food and PPEs, these personal protective gears, masks. But if you give them food, they'll remain at home. You understand? So if people want to give, please give food. Our people in the slums, especially the poor people, some of them have lost jobs because of this timing. Some have been relieved of their duties. They are suffering. And this is an appeal I want to make to Kenyans and corporates, religious bodies, everybody. Even don't worry. Even if you're coming to give us a packet of unga,
okay,
it is still appreciated. You give us a lorry load, it is still appreciated.
Asante
Let
sana.
us assist. We are all Kenyans. We all live in this country. This is the time they need us. We go and support them.
And these are the hand sanitizers you brought with you.
Yeah, these are also sanitizers we got in the county from. These are not government. These are private donor, and we are also giving out to when we go fumigation at night.
Okay.
We give out food, we give out masks, we give out sanitizers, we give out soap. Then we give out posters educating them how to wash their hands. So you see, those things happen.
Asante sana, Bwana Waziri Hitan Majevdia. I appreciate your time. And hopefully, by the grace of God, we will all weather the storm. And when the dust settles, then we can have the objective discussions on how to improve our healthcare system in the country. And perhaps with the virus now affecting how we all live, life is literally on hold. I mean, places that used to be entertainment joints no longer are alive. And you can see how it has entirely affected the global world across Asia, Latin America, in the United States of America, Europe, and in Africa equally. But all the same though, we will navigate, and maybe this storm will come and clear the way for us here in Kenya and reduce dependency on foreign countries for proper medication and perhaps restructure the Kenyan healthcare model. And thank you so much for coming. Thank you to you too. We'll see you next week here on the broadcast. Good night.